Hello and welcome to this workshop, which I have named Spontaneous, Responsive, Relational. And we're going to be taking a deeper look at how to work effectively with desire discrepancy within couples. But before we get into the nitty-gritty, I thought you might be interested to know a little bit more about me. My name is Dolma Beresford and I am a psychotherapist and couples counsellor, and I work in private practice in London, England. I am married, been married for 1,000 years, and many of those years have been extra happy because of the influence of relational life therapy. And I also have 2 grown daughters, and again, good relationships which have been really helped and supported through RLT. And I hope that I walk my walk and talk my talk is what I'm really hoping to achieve. I did my initial basic training as a psychosynthesis psychotherapist, which I like to think of as the original parts model. And then I've went on to do different trainings. I have trained with Janina Fisher. I'm a TIST certified therapist, and I'm also an RLT certified therapist. And I went on to do a psychosexual training, so I'm also certified psychosexual therapist. So I'm bringing all of those different modalities together in this particular workshop. A lot of this workshop will also be about my personal experience. So I'm going to be bringing personal experience as well as a kind of looking through it as a clinician. So what are we going to be learning about in this workshop? Well, first of all, we're going to be looking at why psychosexual or working with sexuality is not very well incorporated in a lot of trainings. And I'm only speaking from my experience. So my basic training is psychosynthesis. It kind of touched on sex and the erotic a little bit. Couples therapy training, sex is there, but it's not like a huge piece. And therefore, where do we learn? How do we learn to work effectively with psychosexual issues? And in the UK, a psychosexual training almost is like a kind of standalone training. That's kind of like the missing jigsaw piece. And so as a clinician, I was working with individuals, I was working with couples, and they were bringing in issues to do with their sex lives, with their relationships and desire discrepancy. And I was finding myself a little bit out of my depth, not really knowing how to work efficiently and effectively with some of these things that the clients were bringing. And therefore, I decided that I was going to do the psychosexual training. So we're going to be looking at why sexuality isn't that well integrated, and mainly I think is because it's a really big topic. Then we're going to be looking at desire discrepancy and really looking at it as a core relational issue and not just as some sort of deficit. So we're really going to want to reframe that for clients. And the way we're going to do that is by looking at spontaneous versus responsive desire, and that as a psychoeducational tool for reframing this and normalizing. We're also going to use that as a way to reduce shame, blame, and all the polarization that can happen in terms of couples. So we're also then going to look at moving beyond the traditional linear model of sex, which is quite goal orientated, and people are much more, know this model much more clearly. It's kind of in movies and TV. We're kind of brought up with this linear model. We're going to introduce a new, more circular model, which is all about choice. And we're going to help couples really understand that, like every other area of life, our sex life sometimes needs some work. And we're going to move or reframe this idea of kind of scheduling into prioritizing. How a couple's going to prioritize what it is that they want, and what do they want, giving them choice about the type of sex life that they would like to achieve. So we're going to talk about how we talk about sex with couples, especially if this is something they're not used to speaking about. It's obviously quite sensitive and very personal. So working out how we speak in a relational way. And we're going to also have some tools around what are the conditions for good sex to really get the clients, couples, to look at what works for them, compare notes, develop an idea of the type of sex life they would like. And I hope that by the end of the workshop, you as clinicians will come away with some really practical tools for working with desire discrepancy within your own practice.